Hey guys, we're going to do one today on schizophrenia. It was requested from one of our followers, so we'll go through it. Now, honestly, with this disease, there are a lot of exceptions to the rule because of what it is. It is a mental disorder. Some people actually, what you would call, qualify based on diagnosis as schizophrenics. Some may be mild schizophrenics. So you want to take a little bit of this with a grain of salt as well, because it is hard to diagnose. You do need to go to a psychiatrist, psychologist to actually get the diagnosis of schizophrenia. It is a disease where you have reoccurring episodes of psychosis, which is a detachment from reality. Some people may hear voices, they may hallucinate. Other people will have like a flat effect, which means they have no emotions whatsoever, no desire for anything either positive or negative. You can also have delusions of grandeur, which means some people might think that they are royalty from England, for example, or the President of the United States. It's a delusional aspect that they believe is fully real, even though everyone around them knows it's not. You can see with certain people, social withdrawal. That is kind of the gray area where I said you need the diagnosis, because social withdrawal could be a lot of things. It could be depression, it could be hormonal, it doesn't have to be schizophrenia. Disorganized thinking is accompanied with most cases of schizophrenia because you are delusional, you are having things go on in your brain that are not real. So the disorganized thinking comes with that. Symptoms come on slowly generally. 75% of the patients with schizophrenia will develop slowly over time. You first see them in early adulthood, and then they gradually become worse as time goes on. Usually patients have other mental disorders as well with this, such as anxiety, depression, especially patients that are bipolar. You can look at something like this occurring as well. Mainly with that, you're going to see it's a smaller percentage of the population, okay? You're looking at 0.3 to 0.7% of the population, so not a lot of people. Males see it more commonly than females. There are genetic triggers as well as environmental triggers, okay? If you have close family members who have schizophrenia, you're going to be more likely to have it. As far as environmental triggers, this is kind of interesting. Number one, if you are raised in the city, and I mean a big city, not like around us, some people consider Scottsbluff is a city which has roughly around 15,000 people. No, we're talking about a big city where you're looking at like 500,000 people or more, okay? If you have early illegal drug use or marijuana use in your early years, you're going to be more prone to be schizophrenic. They found that that actually triggers some synapses in your brain that can cause issues later on. Childhood trauma, both physical and mental abuse as a child, you're going to see the higher possibility of schizophrenia. Poor prenatal care. Again, that's something you can't do anything about, but as a parent, or if you're going to be a parent, remember how important it is to take care of yourself when you're pregnant, as well as patients that have had severe infections in childhood and into adulthood. They're finding out that these infections can cause autoimmune reactions. And schizophrenia is not an autoimmune disease. However, they've correlated that as well with this. So you want to watch out for that. If you've had that, it may make you more prone to schizophrenia. Half of patients will improve over time and with no relapses. So that's a good thing. I mean, it is something that can be controlled, and you can actually live a halfway normal life. A few patients will totally, fully recover and have no other issues. So it could be that a trigger brought on maybe by stress, brought on possibly by an infection or a traumatic event may have triggered it, Once that's dealt with, it goes away and never comes back. However, you do want to watch out for anything that would reoccur later on. Kind of, I don't want to compare it to, but like cancer, you can go into relapse, but you always want to keep an eye on things just in case it does come back. With schizophrenic patients, there is a higher rate of suicide and other health-related issues, and predominantly it comes from the delusions of like grandeur. When you think that you are more powerful than you are, or younger than you are, you do foolish things, and that can get you in trouble. Because your body just can't handle what you think you can do. So if you go driving in a car 100 miles an hour and you miss a turn, there are consequences to that. And those are the kind of events that happen with schizophrenic patients that lead to death. So there are positive, negative, and cognitive schizophrenic patients, okay? With the cognitive patient, or with the cognitive schizophrenics, they are the ones that don't respond to medications. They're the ones that also have the things like withdrawal from society and family, the no effect, where they don't really show emotion, they don't really have feelings, they don't really care about what's going on around them. They don't respond to antipsychotic medications like the positive and negative patients, okay? In the positive patients, those are the patients, again, that have the feelings of grandeur, that they have the delusions that they are actually more than they are, and those patients tend to respond to treatment with antipsychotics, as well as the negative patients that kind of go the opposite way, but also those are the patients that may have more hallucinations, more hearing voices, but they tend to respond better to antipsychotics. Now, antipsychotics are basically your first line treatment with that. You really want to watch out for side effects, because with antipsychotic drugs, of course, you can see dizziness, drowsiness. You should not have any alcohol with them, but you can also see elevations in your blood glucose. So if you're a diabetic, you really have to watch out for that. You need to be checking your A1C and your blood sugars. You can also see weight gain with that. And then something that a lot, especially if you're using older antipsychotics, that you can see is ataxia or tremors, where you get this kind of thing going on. Your lips, you can do some lip smacking, your tongue smacking. There are medications to treat that. A cheaper one that you could use would be like amantadine. They've used that and had some success with treatment on that. There are a few other meds that you can treat. I don't like treating side effects with meds, but if you need that to stay normal and not have your delusions, not be going through periods of psychosis, that's what you need, well then we'll treat those side effects with these other meds, okay? Benztropine is another one that will also help with that. The other thing with that you can do is psychosocial treatment, and you need to get a good psychiatrist or psychologist to help you out with that. The patients with cognitive form of schizophrenia do respond pretty well with psychosocial treatment, so that's something to look into, as well as treating with antidepressants too will help. It is a lifelong disease. You can lead a halfway normal life with it, but you do need to keep an eye on it. You do need to have your family and friends also keep an eye on you, because if you relapse and go into a period of delusion or psychosis where you're having issues again, you may not have any clue that it's going on, but those around you surely will. And at that time, if you're not taking medications, or if you're not going to psychosocial treatment, you can get back into that. But most likely you will probably be on an antipsychotic for perhaps the rest of your life. The goal there would be to control symptoms at the lowest dose possible.